as a social service assistant. I was working under the MSPI, DVPI federal grants. And my main focus for community involvement was of using that for my project is because we have such low participation with community members attending our events. So my project description is developing new ways for the adults to attend community activities with their families. In the past, with involvement, there's been a huge lack of parents or guardians showing up, or they'll drop their kids off. Or there's like one person with like 10 kids coming to our events. So the details is I utilize community feedback from surveys that are handed out earlier with the start of my project. And I showed the surveys last time. So the three main focuses of this, the responses I had for my surveys was how did adults hear about events in our community, and a lot of them said that they heard about our activities through word of mouth or through our Hukadi Hochoka Agdi Facebook page. But we did hand out flyers and send out like newsletters and like let the other providers over at the clinic know about it. And other ways that I asked what they suggested for advertisement was through our tribal page, and sending notes to home with students, but unfortunately due to COVID they had online learning, so we couldn't really do much about that. And then post signs around the community, which we did, and we had a bad feedback of like people taking the posters down or calling. And I also put down times for what times would work for people, and there are kind of like various times that people suggested. And then I asked the same with the youth, and then they had the same exact feedback. And I also asked if they enjoyed the activities, and with over half of the responses, they put that they're kind of neutral about how they felt towards it, or they're satisfied and somewhat dissatisfied. Other details of the project was utilizing entities for resources, challenges that were faced and challenges that were accomplished. The types of activities we had was our talking circle, teen talk, family spirit program, many broken hearts, domestic violence awareness activities, Halloween parade, pumpkin bash, Christmas activities. We also did a TikTok challenge when COVID hit in the summertime, because we didn't know how else to reach out to our youth. And then we also did like a gingerbread house competition. So the things that we improved on were incentives. A really big thing was that the collaboration I did with the other tribal entities was very helpful. This summer, or last summer, we did a kind of like a health fair on our IHS campus, and 3 of the entities I collaborated with had like a lot of resources to use, especially with snacks, since that was kind of another big issue where people complain about not having snacks or food during events. And then advertisement, we also put flyers in the primary care providers' rooms over at the main clinic. We had other entities share our flyers on their web pages, or they printed flyers out and handed them to their clients. And our tribe also shared it on their Facebook pages. So entities that worked and collaborated with me was the Tribal Courthouse, ICWA, the Housing Authority, Tribal Council, Native Hope, the Women's Shelter, BIA, DSS, Head Start, Corporate Tribal School, Native Connections, and TOUR. problems that were met were that some events that we hosted, we contacted the outer district representatives to uh, and gave them some of the like the tools or other utensils that we had or goodies for them to hand out in their own district. Our other two districts are like Crook Creek district is 20 minutes away from our main district, which is Fort Thompson, and then Big Bend is close to an hour away from Fort Thompson. Ongoing challenges was COVID. It was a really huge challenge where we had to cancel a lot of events, community events, and being short staffed. Oh, and then things to add, even though we did have COVID and stuff, I had to really kind of brainstorm and think out of the box for events. So the activities like the gingerbread house challenge and the TikTok challenge, I had parents send me or direct message me on Facebook to like post their videos or their pictures and stuff and share it on the page, which we got really good responses and feedback from, and we had a good increase of numbers. Another thing that was brought up was that during our surveys, they asked about hosting events at specific times. So during the warmer weather, we hosted like outside activities on our campus, and from like 11 o'clock to 3 o'clock, we would host like a walkthrough or have tabling, and that really helped with our numbers and people coming through. I think the last two events we had from the summer, which were tabling events, we had over 100 people show up. That was even including parents. And then another good thing too was that during last summer, the tribe managed to work with BIA to start a youth program. So we had quite a bit of youth volunteer with our activities that we hosted and partnered with other entities with. And with advertising, our integrated behavioral health consultant over at the main clinic asked individuals when she seen them at the clinic if they wanted to be put on our newsletter. So we kind of had a good newsletter list to be sent out. And our newsletter consisted of like just information related to behavioral health or substance abuse or awarenesses. And we also posted like activities that were going on in the community. And then we have our Hupati Hochoka Agdi, which is our monthly meetings that we hosted. And in the past, we kind of had low participation numbers, but during COVID, we actually had quite a bit of people participate throughout the past few months during COVID, and that really helped get more responses. And we were able to collaborate more with other entities because they're trying to work through how to handle and reach out to people during COVID. Other than that, I felt like I was a little kind of all over the place, but any questions or comments?
I have a quick question. So did you, I heard you talk a lot about community events where they were able, to come outdoors to events. And then the ones where you had them submit in videos and things like that. Did you do any other virtual type of events, or did you have a low number of those?
So on our Facebook page, I believe we did, we partnered with Great Plains Tribal Chairman Health Board, and we managed to have people, we did like educational events and recorded and live streamed on our Facebook events. I think the two we had was human trafficking, and I know Tour has been posting weekly sessions on facts about substance abuse, FAS, and opioid use.
Mashaya, have you gotten any feedback to how well received like the Facebook postings or your Facebook collaboration was, or even the some of the virtual events that you put on? Have you gotten any feedback on those from the community?
Yeah, if I see community members at our other events, or if I like or if I'm out in a community, I'll get like word of mouth, like responses of that they enjoyed the activities that were being hosted, or some people will DM us through our Facebook page.
Nice.
Mhm.
Has that opened up like a new audience for you? Maybe people that you didn't normally kind of get at your in-person events, or a new age group or anything like that?
I want to say I probably had like a few elderly people respond and said that they enjoyed the Facebook live streams. I know during COVID, the elderly people were very scared and like stressed out about being out in a community and that there's not much to do. So we sent them like cute like care packages and stuff along with live streaming our activity. So they'll let us know if they watched it and what they enjoyed about it.
It's very clear to me, Mashaya, that you have really increased your activity in your community enormously. And you are in Chicago, so that's a big area.
No, I'm in Crow Creek. I'm in South Dakota. I'm in a
Oh.
rural area.
So you have moved. Okay. Sorry about that. How did you decide that this was specifically important to do?
So from going to other meetings that a lot of the other entities hosted, even like if I talk with like tribal council, they always brought up how like there's so much resources in our community and they have such amazing programs to offer for community members, but it's just hard reaching out to people because in our community there's a huge lack of individuals who have homes. They're always hopping home to home for places to live, or they have very little cell phone service or like phone usage to get in contact with people. And I just figured that trying to be more involved with the community, I mean, it would help be a good resource and outreach for other entities to program with, and along with like getting good participation numbers for our grants as well.
It looks like you were able to reach that goal. Did you do any evaluation or ask people other than word of mouth and meeting them in the grocery store or in events? Did you ask them a little bit about how this went, how they thought this was?
I only kind of sat down and talked with other entities in the community. I did not have time to do a like post survey about the activities we hosted the past 2 years because I was close to my due date, so I didn't have time to get anything done. So
Very impressive.
Mashaya, some of these events are obviously more seasonal, but are the others ongoing?
yeah, so quite a bit of our other events are ongoing, like our talking circles are on a weekly basis, and then Family Spirit is a new curriculum we picked up this summer, and we've been like trying to offer it to the clinic. But since I'm interning now as a social worker, my supervisor is suggesting that I could reach out for integrated behavioral health and work with moms, expecting moms, and using that curriculum through there. Many Broken Hearts we still use, but we're kind of short of staff right now. And then like two other like annual events that we hosted, like there's a suicide prevention walk I forgot to add, and another event that I forgot to add, I can't think of, were annual events that we had hosted the past 3 years. And we got I wasn't here for last September's suicide prevention walk, but the individuals that did host it in my department said that we still had a good outcome, even though there's COVID going on still.
Mhm. Very good. And are these events, do people come as a family, or does it sometimes, is it sometimes just the younger people who's showing up, or only parents?
So in the past, before COVID, it was mostly just like children showing up because they're always out and about as it is. We'd usually host our events at the tribal hall, which is like the center of Fort Thompson, and usually kids are always out playing by the playground there, and they'll show up. Or sometimes like one like grandma or grandpa would be bringing like 10 different children with them and stuff. But I noticed during COVID, we had a lot more parents attending with their children. I think I should have calculated out the numbers of adults that came with, but there's quite a bit of more adults that attended our past few events.
Mhm. Yeah. Very good. It seems like the purpose of this project was, you got some more engagement from the adult population. And is this programs that you're planning on continuing, when the next season come around?
So we did finish up our grant last fiscal year, but we have a lot of carryover money to use, so we'll be continuing to do
Mhm.
some of the activities. So
Very good. Does any of you have questions for Mashaya about her programs or her project? I see some from the Leadership Academy 4 are here too.
Mhm.
I have a question. I just wanted to know where you found your motivation. We talked a lot about this in San Diego, but I was just curious how you found motivation, to do some of the activities during this time, and how you sort of, I don't know, found that resilience to keep going.
I don't know. I kind of just have that mentality of if no one else is gonna do it, I might as well do it myself. And I mean, it was very disheartening and I don't know. I like before I did this project and stuff, I don't know. I was let down a lot because like we had horrible turnouts and some of the other programs like the tribal entities weren't helping and I couldn't get them on board and I really wanted to get like give up, but I mean in a way I mean no, if no one else is, people start noticing and stuff, and since I've been consistently like pushing through and continuing these events, even with low outcomes, more community members were noticing and stuff. So I kind of built a trust with them to keep it going.
Yep, I hear you. It seems like that. Um, that's a good way to show your resiliency, but it's also just a way to motivate other people to see that you're actually moving and doing something. So good job.
Thank you.
Your talking circles that you posted, are you doing those in person or virtually?
So as of right now, we kind of so I guess in the past few months, I think it's been close to a year now. We've been having them in person, but we usually just let people know like we can only have like a max of 6 people because our room is so big to have so many people social distance in them and stuff. We just let them know like they have to continue wearing their mask and stuff. And usually we kind of average about like 3 people per talking circle since it's kind of during the work days.
Let me ask you, did you because there were a lot of activities going on, did you rely on an outside advisory council from the tribe?
Not really. The tribal council, I just like gave them a heads up. Like, one other thing was that when I planned activities, I made sure those who are collaborating, we knew at least 2 months ahead so we can plan ahead of things to be more organized, because I noticed in the past people would just like try to do it right then and there, and it was so unorganized and there's lack of communication. But I would like talk with like tribal council or other entities 2 months in advance, because they need to like get their budgeting out of the way and stuff. And tribal council was on board with the council representatives I did talk with, and they just basically said that they'll try to help with as much as they could.
Mhm. So it sounds like you had support from the community.
Yeah.
Administration. Mhm. So let me ask some of the people on the call here from cohort 4 who might be in the thick of thinking, what am I going to do with my project? How do you think about what you heard Mashaya talk about today? What were your thoughts?
I know I've already like done mine, so I can't really change stuff now. But also I had missed part of her presentation because I was in another meeting. So
Mhm.
don't have much to share, I'm sorry. But I appreciate what I did see of your presentation, Mashaya.
Mhm.
I have a question.
Mhm.
Hi, thank you so much for sharing your project. I'm wondering, yeah, I missed a little bit of the presentation as well. I'm sorry, I joined a little late, but I'm wondering if you can share any learning experiences. Like, did you learn anything about yourself, or do you have any advice to give to Indigenous students and young professionals as we go about our projects?
So the first time we met for our learning academy, I felt like mentally I was a hot mess and unorganized and just like all over the place. And when I finally got to sit down with my mentor, she really helped ground me in a way, help list out my priorities. Like I think we did our what is it called? Our individual I can't think of that word now. Our
Individual project plans.
our individual project plans, and how we felt in just working in mental health was as it was. And then the exercises that we did during the learning academy has really like opened my eyes. I think when we were in New Mexico, we talked about work fatigued and or burnout and passion fatigue or something like that. And before that, Chris, my mentor, was telling me about just trying to like ground myself and make sure I don't get overworked and list out my own priorities of what I want to get done, and start to realize and learn my signs as it was when I start feeling like I'm gonna burn out. I don't know. She really helped get my ducks in a row. So, and as like education wise for us being students, it's kind of hard in a way because there's not as much research with Indigenous populations now, and even in the past within research data. So it's kind of like you're just going with the flow and trying to get as much as you can with like learning from this academy and whatever other learnings you can pick up from your organizations. And so it's just, I don't know, it's a lot of trial and error, and along the way you try to find yourself. But I mean, the Learning Academy, you start to build good connections and resources. I believe another mentor, I sat down and talked with her during lunch with a few others, and she had the same like issues and worked in the same grants as I did, and she like gave amazing feedback too. So it like boosted my confidence more. Like, oh, I have like more ideas now that I can do with our community and stuff. So.
And you're absolutely right. There is not enough research and background information, but that's why your programs are so important, because you're starting to develop experiences that you can share and that are very important to motivate other people to do the same. So yes, you don't have as much, but that's a great opportunity and challenge for all of you to help develop literature and experiences from your leadership programs.
Mashaya, do you have any other comments about the Leadership Academy? I know you couldn't be present during the graduation, but you did attend the first two events.
I guess the only other thing that I can add was I got to meet people from like all over the United States in the Leadership Academy. And like one thing is that us working like tribal and with our population is that we all face the same struggles. So it made me feel less lonely, like, oh my gosh, like just working in a small rural area. It's just like I just felt so stumped and couldn't like think out of the box, and like being able to sit down and build a good relationship with the other mentees and mentors, it like made me feel more confident that I can keep pushing through with my project that I'm doing.
Very, thank you.
I'm delighted to hear that.
Any more
Ray,
comments?
let me ask you, I know you are in the car most likely, but do you have any comments or thoughts?
Good afternoon, everyone. Well, fortunately, I'm not in the car. I thought about it, but then I opted not to because I'm in isolation. But I was wondering, as you're describing your project there, how your next steps are going to look like, because you're working with, you know, in a rural area, like you said, with your tribe. You've done some really good work that you shared with us. And what's next for you in terms of your programming and your learning?
So for my learning wise, actually an interesting thing was that during the first time we met for the Leadership Academy, I was so I really like looked up to all the like mentors and other mentees because they were like doctors in psychology and licensed counselors and stuff. So I'm finishing up my last year of grad school for my MSW to be a clinical social worker. And for my to carry out with my job is that I'm waiting for new hires to get on board to like kind of show them like the ropes and like how and like brainstorm with them and just help them out for doing like outreach and other community activities along with case management.
Any other questions or comments for Mashaya?
Well, I think, Anne, it'd be available to reiterate something that we share pretty often. And it's that we're cohort that continues on, and certainly the networks that we develop through this process um, continues with our work and where we move on, and so we offer this open invitation to each other to stay in touch and we continue to be here to support, to guide, to learn from each other in the times ahead. So particularly now with the pandemic going on, we have a lot to learn from still, because we're blazing paths that are not like the path I followed when I was coming out of grad school and beginning my work. Is so much different. But there's some parts that don't change. I'm working on a community project right now where I'm doing a strong community-based outreach project, and I still have to get in my car and drive to communities, but a lot of the communities that I go to are partially closed or the meetings are limited. I think I went to a meeting last weekend at a community meeting, and they only had a certain number of people they allowed into the meeting. The rest of us had to sit outside the building listening virtually, and participating virtually, but still doing that. So that's how our lives have changed into a packed room and been able to interact one-to-one with people and get things done. But it's quite a bit different now. So those 2 points I'd like to make. We're here and going to keep on going. And but the work that you all have is quite different than the kind of work that a lot of us did 5 or 10 or 20 years ago with communities, even clinically.
This is a very important point, Ray, because we are in very uncharted territories. And we all hoped, I'm sure I'm not the only one, we hoped that this was done last fall. And here we are again, and we are struggling with a new variant, and it's kind of learning for all of us. And I know for myself, learning that what we thought in 2020, when all of us left to Maya in New Mexico, we thought this was going to be 2-3 months, and we are entering the 3rd year. So it's getting to know, how are we going to do this? How are we going to maintain? And the advantage of this is I have always wanted to have regular alumni meetings with all of you, and I wanted to find a way to travel you to a place where we could meet. Well, that may not be doable in the nearest future. However, this format makes it possible. So there are advantages and disadvantages. Of course, we all want to have the experience of being together in the same area and in the same room and congratulate each other the way we usually do. But I'm not sure when that's going to happen. We did it for the cohort 3 when we were in San Diego, but we haven't been able to do it afterwards. We haven't been able to open up the possibility of knowing when can we do a new cohort of Leadership Academy mentees and mentors. So we are in very uncharted territory. And still, I think it's a very, very important community that we have established. And I really am looking to all of you to help us maintain this, even though we may see each other just in a little box for the time being.
And I just want to add, Anna-Lena, so in our last coffee clutch, we talked about how to move forward, and it turned out that people wanted to continue meeting in the coffee clutch. So we will keep that going a little longer. So I think it's every fourth Tuesday that we're meeting at 11:30. So please continue to come if you would like to and have the time. And I just wanted to say thank you, Mashaya, for staying with us this long and coming on to present your project. And you should be on the outlook for something in the mail. Everyone got their diploma, so we will be sending this to you together with a talking stick. So congratulations, Mashaya.
Can I just say something real quick?
Of course.
Congratulations, Mashaya. You finished, and it's good to see you, and congratulations on the new baby. So just wanted to say congrats, you're done.
Thank you. I just gotta finish up grad school by the end of this year, so.
That's no
You can do
problem.
it.
Yeah, that's true. For some people, it may be a challenge. For others, it will be a breeze in the park. We have one graduate student who was suddenly telling me, you know, I didn't plan this. I haven't graduated yet, but I'm going to have a baby in January. And we just had to celebrate. I mean, what can you do? We just have to enjoy that our team was expanded with a 3-week-old baby. Any other comments? I know one person who is on the line who was in the same situation as you, Mashaya, who couldn't be at her graduation. And that is Christina Pacheco. Are you still on?
Christina had some internet problems. She was on here for a while, but she lost her
Yes.
connection. Yes.
She needed to do the same. She needed to call in because suddenly there was something going on in her agency. So Sunny wanted to say something.
Hi, I just wanted to say amazing job, Mashaya. Like even from the get-go, from the initial presentations, I think a lot of us mentors were really blown away already. And we're like, how old is she? I mean, she's doing amazing work.
Yeah.
She's doing work like she's worked in this field for like 30 years already. And, you know, it's just an amazing wealth of knowledge. And, you know, I appreciate all the work that you've done, and we were looking forward to seeing you and the baby in San Diego, but we'll have to meet up some other time. But again, you know, congratulations and on the baby, grad school, everything. And just to have the amount of energy and do the amount of work that you do. I mean, before you came to the Leadership Academy, you probably already had some mentor status there. So, you know, I really appreciate all of your knowledge that you brought to us all. So thank you.
I just want to say great job too. Man, I don't, you know, when you look at it, it's like, think about all the things that we have to go through in life, and it's pretty cool that you're able to juggle it all. So, you know, I just want to say congratulations, and you're doing a good job. You know, work and baby and graduate school and Leadership Academy and global pandemic, and here we are. So, you know, that's freaking awesome. I just want to say you're awesome, and I'm glad that you were a part of our group, and I was able to be a part of it. It's just been a great experience. So congratulations and awesome job.
I wanted to say the same thing too, is congratulations, a good job. I'll be graduating in May as well, so I am just excited as you are to be finished with school. I didn't have a baby though, so congrats on that. One thing I wanted to say too was, I've kind of lost track with the Leadership Academy from San Diego, just because I was in the MSPI DVPI grant as well, and it ended. So I had to close out the grant, and then I had to come up with a whole new job in order to stay employed, because that was a grant. So I had to make and develop a whole job description for myself. And then 2 weeks ago, the pandemic got worse again, so we closed down again. So we are totally on restrictions again for a whole nother year. So to see your presentation and how you've pushed forward with your personal life and everything that's going on within your community, and you working with the grant and everything, it's really good to see that. And I'm hoping to get back on track with the Leadership Academy, since now I'm stuck at home for another year. Our facility completely closed down again. So we're not even allowed to leave our county now. All staff are not allowed to leave the county. So we are on total restriction. So I'm hoping I'm able to work on my project a little bit more and get back on track. So I just want to say good job. And, it's really helpful for me to see how you push through with all of the challenges that you were faced. So thank you.
Yeah, I continue to be so impressed with all of you, with all the challenges that you have had with COVID and your community health. You're still doing this, and I am very impressed with that. And very proud.
Can I add something?
Of course.
Excuse me.
Yes.
Good afternoon. Yatse. It's good to see you, Shiaja Kayla. I lost you somewhere. It's so wonderful to see you. And it's good to see everyone. And the young lady, beautiful job. Awesome job you've done. And what people are talking about, just what I've seen when I went to San Diego, with you all being young ones. Oh my gosh, it just overwhelmed me when I was in San Diego, and just listening to your presentation. It's like, wow, look at our kids, look at our young ones. They're preparing for the future. They're taking over where we're gonna have to go sooner or later. Like with myself, Ray, and we're going to have to vacate these jobs, things that we do, and you are coming in to take care of our people again. I am so proud of you. It's just so heartwarming what I saw in San Diego, as well as what I'm seeing here again. So it's so great that, what presentations you've all done, what I've seen, what I've heard. It's a beautiful job that you guys are doing. I just want to say thank you. You are the future that's going to take care of us.
Yes.
So thank you.
And I don't know, Monica, if you have shared with our colleagues and friends here that we have decided to create a series of webinars where you guys are going to present your projects, and we want to share with the world how great you all are. That doesn't mean you all have to do it, but I would very much encourage you to join us, and you can use your PowerPoint from your presentations and elaborate as much as you want to. So that, I don't know, Monica, if you have shared that with them.
Not yet, but that was, this is a very good time to mention this. So we have talked about creating a webinar series called something like the American Indian and Alaska Native Leadership series. And we're hoping that all of you will come on and present your projects, because we do believe that it probably has interest to people beyond this group. And I think it's very valuable for others to hear what you guys have been working on. So I will be in touch with you guys about that, and see how many would like to do that. So keep an eye out for an email from me.
Would that be something you would be interested in doing? Okay. Great. And you know, Sunny, you can go back to your old Leadership Academy project too, if you want to present it. Or say, this is where I started, and now I have accomplished all this afterwards. I can't hear you if you're trying to say something.
I was gonna say, so my project was an 8-bed facility, the recovery home, and I'm working on a 14-bed sober living now. So it has expanded since then. So that's my next project, is get sober living apartments up and running.
And that's exactly what Alta is saying, that, you know, we are at one point going to not be working. So we need all of you to do all these very important projects going forward.
Well, I think we are about to wrap up. Thank you so much, everyone, for coming. Thanks to Mashaya for talking to us about our project. And I will look forward to meeting you again at the Coffee Clutch or one of our trainings that's coming up next month. Thank you all.
Thank you. So good to see you. I look forward to seeing you very soon. And stay healthy and safe. I know that many of you are in communities, and Kyla is saying we're now on lockdown again, and just hang in there and be supportive of your community members, and remember what a very, very important role you have in your community, even though it's very tough at the moment. We are all praying for you guys.
Thank you. Take care, everybody. Bye-bye.
Bye.
Bye.